Hi folks, this is Dr. Ravi Kamepali, infectious disease wound care and obesity medicine certified physician in Lima, Ohio. Thank you for taking time to listen to this interesting case of a nice 42-year-old female who ended up having a trauma by fall with epidural hematoma, ending up with C3 and C4 fracture and becoming quadriplegic and ending up on the ventilator. Initially, we had seen her care deliver and delivered her care for complicated problems with fever. This happened in October 15, 2017, when she ended up with this accident. And she ended up having infections, and we improved her clinical condition and discharged her to the nursing home. Unfortunately, after the discharge to the nursing home, she ended up having problems with this necrotic stage 4 Decubitus ulcer after 3 weeks of presentation to the nursing home, and she ended up having significant problems with malnutrition and necrosis of this area, and essentially, unfortunately, the patient was being planned to be sent to the hospital, but scheduling problems kind of prevented, and also detection of this problem sooner could have been done, but that did not happen, and she ended up getting admitted. And if you see, we had immediately transferred her and prepared the wound bed and did a diverting colostomy and debridement of the necrotic coccyx ulcer. And after this was done, she was essentially moved to the long-term acute care facility on 2/8/2017, and she ended up continuing with wound vac and wound bed preparation and nutritional supplementation, and essentially with options of care including flap procedure were considered. Also, vitamin supplementations were done, including vitamin A, E, C, zinc, and arginate, and we did get a clinitron bed also. And apart from this, physical therapy was also seeing the patient. And as this was being done, and as she clinically improved, unfortunately her insurance did run out, and she had to be transferred to the nursing facility. And her wound bed improved remarkably, but the care plan was complicated now that she was going to the nursing home, and she was very distraught with it when we assured that we have technology with telemedicine that we could then use to provide care, at which point she agreed to go to the nursing home. And the nursing home, unfortunately, was around 2 hours away from Lima in Napoleon, Ohio, and that was the only nursing home in Ohio that was accepting her, fortunately for her. And we assured that we'll follow her using telemedicine technology, and we essentially did that, and closely monitored the wound and continued with wound bed preparation and close monitoring and directing the local nursing home wound care staff about her wound healing, and closely monitored for any worsening. And in between, she did end up having problems with fever, and there was the question of whether the patient had to be transferred or not back to the hospital, but we prevented that by evaluating her via telemedicine, and treated her urinary tract infection around May 26th. And this ended up helping her being kept in the nursing home. And as the wound bed was prepared by 7/1/2017, we decided to get extracellular matrix with which is porcine liver material that was acellular, was brought in and applied to the wound bed in the nursing home. And if you see, on by 7/11, we did continue with the local wound care, and the graft was still attached to that area and absorbing. And slowly but steadily, the wound bed was continued to closely be monitored, and ended up that by 2017, she improved to that status with significantly improving ulcer bed, and by 9/18 she improved. Her skin had epithelialized remarkably, and if you see the by 9/25/2017 her wound had also improved, and by 9/29 we had recorded a patient testimonial of her overall experience, and I would like you to please see that in the patient's perspective portion on this care delivery. The uniqueness about her care delivery is that we were able to keep her in the nursing home and deliver the care process to her satisfaction, and also we were able to do that with remote solution. I think telemedicine is going to have a huge impact in care delivery, and one physician can be a force multiplier in care delivery in using technology. So this case encompasses the care delivery of a complicated patient who was quadriplegic, had nutritional problems, has had infection issues, had emotional issues, and overall problems with her transportation costs that were prevented, and overall care delivery process that was optimized given her clinical condition. Hopefully, please see the next portion, and that is the interesting portion of patient's perspective. Thank you very much.